Story in mind, we want to highlight how you can spot the warning signs early and what you can do to protect your hands and your wrists. Dr. Agarwala with Cone Health Orthocare, who you just saw in the story, he's back with us to talk about ways to prevent, manage, and treat carpal tunnel. So let's first exactly just kind of do the 101. What is carpal tunnel, and then what are the signs and symptoms?
Sure. So carpal tunnel is just a compression problem. It's basically your nerve at the level of your wrist is becoming squeezed. It lives in a physical tunnel, and over time, the swelling and the ligament that makes the roof of that tunnel can start to create compression on your nerve. Essentially, what it's doing is it's not allowing the nerve to function the way it's designed, and the hand starts to get numb, tingle, and start to create pain and burning.
Okay, and would that be like an all the time kind of numbness, pain and burning, or off and on?
It can start intermittently, where you start to notice it maybe at nighttime. Oftentimes our wrists are bent at night, and we may wake up at different times in the night with our hands numb and feel like we need to shake them out. Sometimes people will describe waking up in the morning with their hands numb, or start to notice it more often with the wrist bent while driving, using a phone or an iPad, something like that. And so the intermittent nature of it is how it begins, but then it can start to become more constant.
Yeah, simple things, not like picking up something heavy. It really is something small that you're doing. Okay. So
Right.
who's most at risk for getting this?
Sure. So there's certain medical problems that can be associated. I think diabetic patients are quite commonly affected by carpal tunnel. Sometimes rheumatoid patients can get it as well, or people with thyroid issues. It can come often in pregnancy, which sometimes goes away at the end of pregnancy, but often can last. And certain modalities like obesity or things like that can also be associated too.
Okay, are there any things that maybe can trigger it, or activities or daily habits that we're doing that could make it worse that we should be aware of?
So repetitive motion is usually the biggest culprit. So anybody who's doing a lot of repetitive motion with the wrist back and forth, I think are the most affected, or people who need to keep their wrists in either a bent or extended position for a long period of time. So people who find themselves kind of locked in a fixed position for their job or for recreational activities tend to start noticing it earlier.
Yeah, I'm thinking of that repetitive motion of all of us typing on a computer for sure.
Yes, that's probably the biggest offender.
All right, and so I'm thinking extended time typing can certainly put us most at risk.
Yes, I think especially when you have your wrist in a bent position. So often I'll tell people, if you can get your wrist in a more flat position or an ergonomic position rather than keeping it bent like this, that can often help, because in a lot of cases people need to use computers for their job or for recreational things.
Right? If we can't do that, because I'm thinking of my own desk and things of that nature, do we need to like stop every like 20 minutes or something like that and move them around?
Intermittent breaks, I think, are good, often for just stretching. For example, moving your wrist around or trying to prevent kind of that locked fixed position for a really long time. So I think periodic stretches, if it's going to be something you're going to do over the course of the day, can certainly be helpful.
Okay. Now, if someone starts to notice that tingling or that numbness that you were talking about, what steps can they take at home to relieve the discomfort or maybe prevent it from being worse?
Sure. So the biggest thing we'll talk to people about is activity modification. So if you're noticing a lot with certain repetitive motions, potentially taking breaks or things like that. Using a wrist brace can often be pretty helpful. So it's something that you can buy at a local drugstore, or something as simple as, again, just keeping your wrist in that straighter position, often as a reminder. That's something simple. I'll often tell people to wear the wrist brace at night too, particularly because we tend to sleep with our wrist bent a lot without realizing it. And that's a very risk-free way to try to help treat the symptoms when they first come on.
Gotcha. Okay. All right. We're going to continue this conversation about carpal tunnel and how we can make sure that our hands and our wrists are doing everything that we want them to do. We'll be back in just a few minutes.